Direct from 7 News headquarters, the latest on the coronavirus outbreak with Michael Usher and Melissa Doyle.
Good evening and welcome. Tonight, the real impact and cost of this unprecedented health crisis is beginning to hit home.
We have Australia's most experienced and informed voices here to help you navigate these uncertain times.
In the coming hour, more kids diagnosed, are young lives at risk? A leading specialist weighs in with essential advice. Surgery slashed. Health Minister Greg Hunt joins us to explain that. And not immune. A young man suffering from COVID-19 shares a very serious warning. That's all ahead. But first, Mel, today has seen a significant spike in Australian infection rates.
It has, Michael. It is day 61 of this outbreak in Australia. And today the number of cases nationally hit 2,426. So around the states, Queensland has jumped 10% today, up to 443 people. New South Wales, the biggest increase, up to 1,029, including a 2-month-old boy and a 7-year-old girl. The ACT is showing 44 people. Victoria now at 466. 55 new cases diagnosed today. Tasmania, 36 there. South Australia, 197. The Northern Territory, 6. And Western Australia now at 205. And if we drill down into the age groups, this is the most up-to-date breakdown that the Health Department could give us. You can see there that the largest number of patients is in the 20 to 29 bracket. So 360 people, fractionally higher than those in their 60s. But as I said, the number of children being diagnosed is also on the rise, which is a frightening reality for parents. So let's bring in Telethon Kids Institute Director, Professor Jonathan Karapetis. And Professor Karapetis, thank you very much for joining us tonight. I think all parents took a little bit of comfort when we were told that children weren't in the high-risk category. Has that changed?
No, it hasn't changed at all, Melissa. In fact, in every country that's been affected around the world, children constitute just a tiny proportion of the total cases.
Yeah, so obviously their little bodies react a little differently than ours. And the other thing too is symptoms. I mean, are they the same? What do we look out for? What do parents keep their eye on?
Yeah, it's pretty much like a bad flu, so very much the same symptoms as adults are getting. So for very young kids, obviously, they don't complain in quite the same way of, for example, a sore throat. But fever, cough, sore throat are the big three that we look for.
I feel like I can hear mums and dads right around the country breathing out a little bit more. Professor, thank you very much. So don't be alarmed, but we need to be vigilant. Thank you for your time.
For more on children at risk due to COVID-19 and a new announcement that elective surgeries have been cancelled in hospitals around the country, I spoke with the Federal Health Minister, Greg Hunt. Minister, thank you for joining the latest. I'd like to ask you first to talk to parents tonight. Against early messaging, some very young children have now been tested positive, infected, and there's been a spike in young people aged in their 20s. Your message to parents and perhaps those younger people who may think that they're invincible?
The very clear message is this is a global pandemic. No country's immune, no person's immune. To young people, it may seem that this is an old person's disease. It will affect them the most, but it can affect and lead to tragedy anywhere. Fortunately, our youngest people are less likely to catch it, even less likely to catch than the flu, and are less likely to be affected, sometimes less likely than the flu. And young people can be a vector for spreading to older people unwittingly, and we would put our grandparents or parents at risk, and nobody would want to do that.
If coronavirus is an approaching tsunami, are we on the high ground now?
No, I would say we are moving towards the high ground.
OK, and last question, can we expect further lockdowns over the next few days?
Look, I'll leave that to the premiers who are following the advice. Those are the decisions that they are making. The more each of us does to follow the rules of hygiene, of self-isolation if you've been in contact or you're in quarantine for one of the reasons, and then of social distancing, each of us can have an impact.
Health Minister Greg Hunt, thank you so much for joining us tonight.
We will get through this.
The Health Minister there. Well, of course, the other big issue affecting Australians today is the rapidly escalating employment crisis. So we wanted to help guide you through what you can claim if you found out that you are out of work.
So permanent employees who have lost their jobs, as well as sole traders, casual and contract workers who've lost income due to the coronavirus, can get job seeker payments. On top of that, there's the coronavirus supplement, an additional $550 a fortnight. People on job seeker, youth allowance and parenting payments will get this, but disability and age pensioners won't. And in just a few hours, Queensland will close its borders to curb coronavirus infection rates. Mac Lyon is at the border town of Tweed Heads. And Mac, is there a big line up there tonight? Is there a rush to get across?
Good evening, Mel. Well, no, not at the moment. A very monumental day in Queensland history. At 12:01, in less than 6 hours, the border will slam shut. Police obviously only announced this yesterday, and its police patrol cars have already started setting up the road. They're saying they'll have RBT-style sites where they'll be checking every single vehicle coming into the state.
Mac, how are they actually going to police it, though? It's not like there's one road in. I mean, how do they make sure that nobody runs the border sort of, 500 k's inland?
We saw a big truck bring in orange traffic barricades this afternoon. It's understood they'll start closing those roads this evening, and then at midnight, only 3 access points. They will be checking every single vehicle, police, but they are also working on an online assessment platform that will mean that people who are exempt from being checked, who won't have to go into quarantine, can get a special pass so they can come and go as they please.
All right, that'll make working across the border a lot easier. Mac, thanks very much.
Let's go to WA now, where there's a growing cruise ship standoff. Our reporter El Georgiou joins us live just off Rottnest Island. The big ship right behind her. El, hello to you. There are now 3 ships caught up in the chaos.
Aboard this ship are 1,300 crew and passengers, as well as WA healthcare workers, after the ship's captain said that 25 of the passengers reported having respiratory issues. So they are tonight aboard and testing those passengers, all 13, not all 1,300 of them, just the 25.
Yeah, I think one of the...
That's 3 cruise ships.
It is. I think one of those ships, in fact, was rejected by Dubai and sent, so it's circling back and coming back there. But what's the plan?
Well, we're being told that the passengers aboard this cruise ship are not going to be coming off in Perth, as I say, because they don't want a repeat of what happened in Sydney.
All right, bobbing up and down the boat. El Georgiou, thanks for joining us tonight.
Let's go inside COVID HQ, where the major decisions are being made, and across to Parliament House. Our political editor Mark Riley is with us. Mark, the blame shifting over that contaminated cruise ship, the one that El was just talking about that docked in Sydney last week, it really stepped up today.
I thought it was interesting that after Brad Hazzard, the New South Wales Health Minister, originally accepted responsibility for this debacle, and let's face it, this is a debacle. New South Wales is now blaming Border Force, and to hit back today, we didn't see the Minister, Peter Dutton, we saw the Commissioner, Michael Outram, there.
Yeah, absolutely, and they're squabbling and saying you did it, no, you did it.
Yep.
The National Cabinet's meeting as we speak. Anything we know from that as yet?
So tonight there's discussion on how the states are providing online learning through their schools, including what impact that'll have on the HSC exams, which we're told are still going ahead, and other discussions about how the health systems are coping and preparing their ICUs for the surge or the expected surge in coronavirus cases. I thought it was really interesting what the Minister, Greg Hunt, was saying to Michael earlier on there. There's a sense of optimism that I haven't heard from the government before.
All right, well, you'll let us know. Mark Riley, thank you. Isolation is obviously one of the ways that we can try and avoid it. Social distancing, we've talked about that quite a lot. But one of the other ways that is most effective to avoid catching it is to actually wash your hands properly, regularly, and with soap. So I want to show you something. Have a look. This is a molecule of virus. So see that round circle? That's the little virus there. And what happens is that the virus sticks easily to our hands. So if you just wash your hands with water, nothing really happens. So you need to use soap. So the soap basically comes in and dissolves and strips away the fat. So see, it pulls away, which means that the virus molecule breaks up. Essentially, though, you've got to use soap. You've got to do it for 20 seconds. So you've heard the little thing. You've got to sing a song. That's the minimum for it to actually work. The other question, too, is hand sanitizers. Do they work? Their effectiveness is diminished if your hands are greasy or dirty. Doesn't quite cut through as well. Better than nothing, obviously. But good old soap and water for a minimum of 20 seconds is the most effective thing you can do to keep your hands clean. So just
kryptonite for the virus molecule.
all day, every day.
There you go. All right.
Yeah.
Thank you. Still to come, flattening the curve. I'm joined by a Nobel Prize-winning Australian doctor leading the charge toward a vaccine. It's a fascinating insight. He'll give us a timeline for when we'll start to get on top of this health crisis, and it is sooner than you think.
Also, more small businesses are shutting down. We speak with one impacted tonight and we hear advice for others affected. What actually happens to you if you test positive? We get the answers from the nation's leading medical voices. That is all coming up next on the latest from 7 News.
We are in a really unusual time with this coronavirus.
I don't know about you, but I've been watching copious amounts of news.
There's a lot of uncertainty and there's a lot of stress.
I've never experienced anything quite like this.
These are scary times.
I know it's caused a lot of concern in my family.
We're all experiencing the same feelings.
It's going to take some time.
We all need to do our bit.
Reach out, keep each other safe.
Take care.
Look after your family.
Stay safe.
Take care of yourselves.
Because if you look after yourself, you look after others.
Remember, we're all together. We'll all help one another. This is a great nation. Stay strong and we'll get through this damn thing.
We will come through this. Don't carry all this on your own.
So be easy on yourself.
Look after each other, cook for each other, and be safe.
We really are all in this together.
We're all in this together.
We're all in this together.
Let's do this together.
And we'll pull together and get out of this.
You're not alone.
Keep a smile on our face.
We are in this together and we're going to get through it.
While stage 2 restrictions may be necessary to slow the spread of COVID-19, for small and medium-sized businesses across Australia, the impact is devastating. From tonight, all beauticians, nail salons, yoga studios and fitness centres will be forced to shut up shop for the foreseeable future. I spoke with the CEO of spa chain Endota, Melanie Gleeson, earlier to see how her staff are coping.
I feel relieved on one hand that our governments have shown strong leadership and made the call, but I feel absolutely heartbroken for our clients who rely on these services.
Yeah, it's your staff. I mean, clients, let's be honest, we can hold out and wait. It's probably a little early to say, but what do you do? I mean, do you stand people down? Do you say just, hang tight, we'll do our best to reopen as soon as we can? I mean, what's the message that you, and I'm sure businesses right across Australia are doing the same today?
For most of us, we're re-looking at how we can repurpose some of our roles.
All the best to you, to all of your staff. Honestly, everybody is just feeling for them and so many others in the same situation. That is what's really affecting everyone right now. So, Melanie Gleeson, thank you for your time. This rising unemployment is causing housing stress, with thousands of Australians now unable to meet their rental payments. So let's bring in Network Finance Editor Gemma Acton. Gemma, what rights do landlords and tenants have?
Well, Mel, it's a little complicated because each state and territory has its own precise rules and timelines.
All right, Gemma, thank you.
Just on the issue of jobs that we were talking about before, I want to, before we go to the break, just show you something that really struck a chord with us today. It's been a very hard day for Virgin Australia staff. 8,000 of them stood down without pay. Almost all the flights suspended, 100 planes grounded. Have a listen to the New Zealand-based cabin supervisor, Cassie Appleton, what she told passengers on her last flight.
Remember that tough times don't last, tough people do. We're all in this together. So, thank you so much from the bottom of our hearts. We truly hope to see you in the sky again soon. Kia kaha.
Oh, it was just... It was heartbreaking. Yeah. I mean, Cassie's one of the 8,000 who, look, if they get back on their feet, she'll get a job back, but no pay, no future. I mean, no, it doesn't know what is going to happen right now.
I don't know how long it's going to be. There's just, I think we're all...
One of the many, many, many who's losing her job right now. All right, still to come, sudden loss of smell and taste, what's behind the new coronavirus symptom and how we can test for it.
The expert pushing for smartphone tracking to enforce self-isolation in Australia. And that is all coming up next on the latest from 7 News. Australia has launched new strategies and restrictions in the battle against COVID-19. So let's bring in our panel of experts tonight. Infectious disease physician Sanjaya Sananayaka and advisory member of the World Health Organisation, Mary Louise McLaws. Thank you both. Sanjaya, I'll start with you. The alarming thing tonight we've been talking about is 2 children contracting coronavirus in New South Wales. That means there's 3 parents are just obviously worried. Were we a little complacent, thinking that children were safe?
They found that fever and cough were the most common symptoms, but the most important thing was that they had a much milder illness than adults. Hardly any of them got very sick.
Yeah, but you also then worry if the 1 in 6 don't get symptoms, are they going to pass it on? But I also want to ask you, we talk about symptoms. Can you explain what actually happens when someone is diagnosed with coronavirus?
Now, if they're at home, they will most likely get a phone call from a public health unit informing them of the result and asking them how they feel. And if they feel fine, they'll be asked to monitor themselves at home.
Mary Louise, let me ask you strongly believe that Australia needs to track people's smartphones to enforce self-isolating. It's been working in other parts of the world. How realistic is this here in Australia?
Most of us have a phone. If we don't have a phone, the authorities can give them a phone. You're asked for a very good reason, so that you don't unwittingly give it to multiple people. So we can do this with simple technology that we already own in our pocket.
A lot of leading scientists issued a press release saying that the health authorities here should be sharing more detailed information and data with the Australian public. Would you support that?
And the more data that you give them, the more they'll understand the rationale for some of the decisions being made.
A lot to talk about at the moment. All right, Mary Louise and Sanjaya,
Yes.
Thank you both so much again. Appreciate it. Indeed. Well, still to come. When are things going to get better? We dive into the numbers to give us a sense of what is to come.
Plus, we talk to a Nobel Prize-winning scientist, Peter Doherty, the man working to flatten the curve.
And inside a beloved business facing a real serious problem, how Meals on Wheels is dealing with the COVID-19 health crisis. All coming up next here on The Latest from 7 News.
Separating out what's fact, what's fake coronavirus news. How to identify the hoaxes on Sunrise tomorrow.
Well, if there is one question that's being asked more than any other right now, it is when are things going to get better? So senior reporter Denham Hitchcock joins us now. Can we really answer that question?
Seems impossible, doesn't it? But I think we can, by making some predictions about our curve, Australia's curve. So this is the graph we know so well by now. Since 100, here are the countries: Australia, South Korea, Italy. Now, so this is where we look into the future to find out where this curve should start to flatten out, thanks to the harsh new rules of self-isolation. Our total number of people infected is actually much higher than it is right now, because it takes 5 days for the COVID test to come back. 2 days for fast track, but the majority is 5 days. So on our current trajectory right now, we are really about there, where it says 5 days. Now, we need to add another 6 days to that to account for the incubation period. Now, that will cover the people who are sick but who have not yet been tested. So the answer is roughly 11 days from now, if we all follow the guidelines. We should start to see that curve flatten out. So that's about 2 weeks to see a result, Michael. We can do that.
Well, still to come, Meals on Wheels has been lending a helping hand for 60 years. Well, now it's facing its biggest challenge.
That story and more coming up next here on The Latest from 7 News.
Well, the number of businesses affected by this virus is impossible to count, but one is particularly vulnerable, and it's the focus of tonight's COVID Diaries segment.
And Denham Hitchcock is back with all of this. Denham, what did you find?
Well, Michael, it's a unique business, not only due to the service it provides, but because of the age of its clients and its staff. The group is called Meals on Wheels. It's been around for more than 60 years, but its drivers are facing their toughest challenge yet. And this is no small organisation, almost 55,000 clients in all states and territories waiting each day, Mel, to hear that doorbell ring.
Oh my gosh, I hope everyone stays safe. Thank you. Thanks, Denham, very much. Well, we will be right back with your Thursday weather forecast on The Latest from 7 News.
Welcome back. Because we can't travel, we're going to try and show you as many travel shots around the world of the places you can't get to at the moment. But there's a shot of the normally packed Positano on the Amalfi Coast, absolutely deserted, as it should be, listening to the strict messages in Italy. We'll look at the temps around our country now and leave that shot up. Brisbane 28, possible shower developing. Canberra 21 and cloudy. And
in other parts of the country today, Bowen 31 and sunny. Newcastle 23 with a few showers, and Karratha 40 degrees and sunny. I feel like today, in all of the stats and the fear and the uncertainty, there was a glimmer of hope.
Tiny shift, wasn't there?
Yeah.
We heard some optimism from the Health Minister, Greg Hunt, some optimism from the Deputy Chief Medical Officer in saying that, yes, the infection rates are rising, but the critical remains small. Only 8% of people had to go to... Only 17 people in ICU, 197 people hospitalised. So it's OK, but we may still have been nowhere near the bad bit of the curve, although we did hear from Professor Peter Doherty saying he believes if we stick to all these government measures, stay inside, stay isolated, do everything we can to stay hygienic, that it could just be a couple of weeks before that trajectory turns into that, which matters.
Yeah.
There you go. All right. Thank you for your company this evening. 7 News, of course, will keep you informed throughout the night with a special bulletin coming up a little later. You can rewatch all of our shows on 7+. For now, though, from the team here at 7 News, that is the latest. I'm Michael Usher.
And I'm Melissa Doyle. Good night.